So we do have a fairly unique reality in rural and remote Canada, and I'm going to speak a little bit towards our particular area of Kenora and that part of northwestern Ontario that is serviced by our hospital. The disparities in healthcare are huge. Very few things in all of medicine can you quantify by patients actually having a worse outcome in terms of longevity. But if you're a First Nations patient in this part of the world, you have about 5 years less life expectancy than folks in Southern Ontario. In fact, and also, if you just happen to live in this region and are non-Indigenous, you have about 2.5 years less life expectancy. These are very, very hard numbers, and you just don't see those kinds of things in medicine when we look at the epidemiology or the data around patients' lives. We also have like very, very significant physician and nursing staff shortages in hospitals. Everyone across the country is seeing that in Canada right now, but it's very much multiplied in rural communities. There's also a lack of equipment. In this slide, I have just a little bit of information about MRIs. So in our population of over 150,000 people in this catchment area, it covers 38% of the province. There's not a single MRI, despite us needing to send from our hospital alone 10 people a day to get an MRI. Contrast that with London, which has 11 MRIs in the similar population density of this other region. So this is something that you're going to see some changes in. You'll see it soon, hopefully, because as this data becomes available, more and more people are advocating and demanding for some sense of equality. These disparities are the most, I think, the egregious inequities that we can have. Now, one thing that's very important and quite exciting is that we can make up for some of these disparities by implementing air medical programs that I'm talking about today. So compounding some of these challenges, in rural parts and northwestern Ontario specifically, we have 50% fewer family doctors in our communities than even the most hard-hit ones in Southern Ontario. In our situation, we have 39 physicians total that service this population, and we are the center for patients to be brought to from all of the other centers for things like psychiatry, for some of the surgical programs, for some of our diagnostic imaging, which we are a regional program for. And our emergency physicians in this area can't stop the deluge of patients coming in. We have 9 physicians. We used to have 22 before COVID. Now we have 9 physicians left doing double shifts, triple shifts, trying to keep our doors open. So these are the challenges that we have. And again, 800,000 people living in Northern Ontario. They have worse healthcare. They have poorer access to healthcare. They die earlier than people in other parts of Ontario. So one of the things that we can do is implement transport medicine. And this has been established in Ontario in 1977. The Ministry of Health and Long-Term Care started a program for Ontario Air Ambulance Service. This then evolved in 2006 to become Ornge. Again, it's an independent, not-for-profit organization that is 100% funded through the Ministry of Health. It is not cheap to provide these services. Helicopters are expensive. They're expensive to maintain with constant overhauling of the equipment to make sure that safety is there. And the same goes for fixed wing programs. This has increased in size quite a bit because even with those big costs, they are more cost efficient for providing care and for trying to get some sense of health equity for those from the rural and remote areas. I'll get into some of the specifics as we go through this. These are the bases that we currently have across Ontario. So you can see on the far left there, that's Kenora, and we're right up against the Manitoba border. Going further east, we have Sioux Lookout, Thunder Bay, Moosonee, Timmins, Sudbury, Ottawa, Toronto, London, and then large number of land bases like Chatham, Kent, Hamilton, Mississauga, etc. And those are providing the transfers in between different centers. So if a small hospital needs to get a patient who is acutely ill and requiring specialized care to a higher level of care, such as Hamilton or any of the downtown Toronto hospitals, Ornge will bring those patients in between those two centers without them usually having to send a physician or a nurse as an escort. Again, there are some guidelines about the kinds of patients that go onto the Ornge helicopters. In general, if it's a long distance, so beyond 240 kilometers for air ambulance, they are suitable for transfer out by an airplane or a helicopter. If they need specialized equipment and skills of the paramedics, such as being put on a ventilator or a pacemaker or infusion pumps, or even very, very critical things like heart-lung bypass. So we put people on ECMO, extracorporeal oxygen, membrane oxygenation, which is a very, very acute modality that we use when the heart and lungs aren't working properly. These are the kinds of things that we will do at Ornge, and the paramedics are trained to that level, which is really, really the highest level of any paramedics in the world. There are things as well that we do, at Ornge that people might not realize. We have a dedicated mental health team. So if patients need to be brought down for assessment, pediatrics and adults, to go down to centers for mental health care, we have a dedicated team that will bring them down to Thunder Bay or Kenora. Kenora is what we call a Schedule 1 facility. So if patients need to get assessments and are a danger to themselves or others, we will bring them down by airplane. Now, these are tricky ones because sometimes people aren't in their, in the right way in terms of their ability to be calm and to not be agitated. And so we do take precautions to make sure that any transport is done in a very safe manner. And we have highly trained people, including a mental health nurse, paramedic, and security that is on board to make sure that this can be done safely. We are moving more and more towards care closer to home through things like telehealth, where in fact, in Northwestern Ontario, we can begin to communicate with most different centers. All hospitals have telehealth, and most nursing stations also have access to telehealth, where patients can be seen virtually by the same physicians that they would be seeing if they would go further south into Southern Ontario. Now, again, I spoke to this slightly about the levels of care, but the transport physicians, transport paramedics at Ornge are extremely highly trained. We do have some primary care medics that are being phased out of the program at Ornge. We are moving towards all critical care trained paramedics throughout the province, and advanced care paramedics, which are ACP flight, we call them, advanced care paramedic flight, are also not the same level of training as advanced care paramedics that you would see on land vehicles. These advanced care flight paramedics have a very broad scope of practice. They have extremely rigorous educational and standardized examination schedules so that they can maintain their knowledge and skills to the point where they can be with patients hours from care and doing a wide range of different skills like obstetrics, delivering babies, dealing with complications of that sort of thing, patients on ventilators that are going from smaller hospitals to a higher level of care. And really, the sickest patients of anyone in the province are what these guys, and like Anthony, who is a flight paramedic, these are the kinds of patients that they take care of. We have physicians at Ornge. We have again a wide variety of those kinds of physicians. We have emergency physicians, intensive care physicians, pediatric specialist physicians who do critical care or pediatric emergency medicine and are certified at that. We do the triaging of patients. We take the calls and we contact the various hospitals, whether it's rural, remote, or nursing stations, and we provide direction on the management of these patients until the Ornge paramedics take over their care and we transfer them down into a larger level of care hospital. It's 24/7. This is not the kind of thing that slows down in the day or the night at any point. It is a very, very busy program. We transfer somewhere around 80 patients a day, and at a busy day, it could go up to around 100. And these again are the sickest people in the province. And we are one of the busiest programs in the world, if not the busiest program in the world in Ontario. And so these are probably the sickest patients in the world at any one time. This is a major large scale operation.